Welcome back. A warning some viewers may find details in our next story upsetting. The state of children's health in New Zealand can be summed up in one word: dire. That's the conclusion drawn by the CEO behind the latest report on the issue, and inequity plays a major role. Here's national correspondent Amanda Gillies with our latest Because It Matters story.
Hayley Smith was just 13 years old when she started self-harming. At 14, she tried to take her life. Over the next few years, fuelled by depression, anxiety and anorexia, she made a further 15 attempts.
I wholeheartedly believed that the world was a better place without me, and there was just no way that I could continue to fight with the pain that I was dealing with, and it was the only way that I could see out of the hole that I was in.
She was counselled weekly and in and out of mental health facilities and hospital medical wards. A psychiatrist once told her mum, her biggest supporter, to prepare for her funeral.
I would be discharged on a Friday and then readmitted the following Monday. I had just become a revolving door patient, and everyone was lost on what to do for me.
The State of Child Health report released by Cure Kids reveals the rate of people aged under 19 admitted to hospital due to mental health has doubled in the past 15 years. But adolescent girls are nearly 5 times more likely to be admitted than boys. In the 5 years to the end of 2021, more than 3,200 children and adolescents were hospitalised for self-harm every year. That's 5 times the average number for between 2000 and 2004. But Hayley said sometimes medical staff would call her an attention seeker and send her home without any treatment. So what more can be done to better look after our young children with mental health issues?
The message for the government is to prioritise child health. So children don't have a political voice. We need better political investment in paediatric health in this country.
Respiratory conditions, rheumatic fever and skin infections are, according to the report, also hugely problematic for Kiwi kids, especially for Māori and Pasifika and those from poorer areas. Te Ahumarangi Marsh Hokianga has rheumatic fever. She was diagnosed out of the blue in December. Being Māori, she's 40 times more likely to be hospitalised with the disease than a European child, and she's already endured 10 weeks in hospital this year.
It was very scary. She's not out of the woods yet. She still has regurgitation in the heart, and so we're due to go for another echo scan to determine how her heart valves are doing.
She'll need monthly injections for the next 10 years, just like her dad, who also had it as a child.
I was paralysed from the waist down. 8 years old. Had to get my injections every month, every 28 days until I was 21.
The report also states 35% of all acute hospitalisations for children are due to respiratory conditions, most of them under 5, a situation that can be summed up in one word:
dire. If we don't do something now, this problem's just going to escalate. We've got children who are being admitted to hospital for preventable illnesses, and we know that the trauma that causes on families alone.
But there is hope on the horizon. Hayley Smith is now involved in Mike King's mental health initiative Gumboot Friday and plans to study nursing in July. She wants to specialise in paediatrics so she can help the next generation of New Zealand children. Amanda Gillies, Newshub.
And if Amanda's story brought up any issues for you, there's a national helpline on 1737 with support available 24/7.